Hello. Let's talk about media and communication. In this episode, we discuss the anti-vaccination movements in Germany and Brazil. Together with our guest, Adriana Amaral, from the Unicinos University in Brazil, we'll look at how these movements use social media to spread misinformation and defy social cohesion. We also address the differences between these two movements and how Brazil's stronger politicization of vaccines has led to a more polarized debate. I'm Rodrigo Silva. Let's talk about media and communication. Adriana, welcome to our episode.
Hi, thank you for inviting me.
Adriana, let's jump into why you and your colleagues found this topic worthy of researching about.
Well, we had this research project between Germany and Brazil, and we were looking for disinformation in digital platforms. But we had another grant specific from the DFG from Germany that was specific to discuss how social media were being spread, the vaccination campaigns were being spread in Brazil. And then we start to look at it. And in our first findings, we thought, oh my God, that's been this big anti-vaccination movement. And then we decided to contextualize it with the German situation also, because it was different, but in a way that has some kind of similarities. And so we start to look at it.
So there was some research before about this topic. There was some surprising elements that you just found. But considering previous research, let me know what were your expectations. So before we jump into the findings, what were you and your colleagues hoping to find?
First, because we saw that Brazil was very known because of the high levels of vaccination before. And during the pandemic, we saw that this anti-vax discourses and narratives were growing and faster, and especially on Twitter, Instagram. And in Germany, we saw that the disinformation were less polarized because they have some specific groups that were more connected with anthroposophic movements, and with some movements that they were not so political. They were more like people thinking about that. How can I say that? People that are like, natural style of life or veganism. So it was very different from the situation we had in Brazil.
Mm-hmm.
And so the disinformation was spread in the same platforms, but in different ways.
Mm-hmm. So same platforms, more polarized in Brazil than in Germany. So let's explore the findings now.
So then we started we had this long work of gathering and collect all the data during 3 or 4 months. And we started just right when the vaccination started in Germany. That was a bit before, and in Brazil a little bit later. And then we discovered that in Brazil, almost all the spread of this information have been organized by Bolsonaro supporters or people who were in contact of the government, and there were politicians and deputies and senators, and also people from that was most unexpected. People were from the health field, especially some doctors, some medicals that were spreading these anti-vax discourses. And they were discussing about chloroquine, that is this pill. So it was very weird. And in Germany, it was not It was a movement very connected to some things about, we have the right to not get vaccinated. And in Brazil, it was more this, if you vaccinated, you become a crocodile. Bolsonaro said that. So there are lots of fake inventions about vaccines.
Mm-hmm.
And in Germany, it was more something connected to, we were worried. This vaccine was made very fast. We don't know what it's made of, but some things were quite the same, like the discussion that the vaccines would transform your DNA and this kind of stuff.
Okay. Yes. And as I was reading an article and you just told me, so these anti-vaccination movements, they vary a bit in the context. Some in Germany argue for more like the personal rights, and in Brazil, even some health professionals and Bolsonaro groups that promote them. My question for you is, because it got me curious to how can we explore potential policy impacts of this? Have you considered this in your study?
Well, so in another paper that is about to be published soon, we discussed about how the health organizations, were using these digital platforms for information on campaigns, but on vaccination campaigns. But we didn't see, how can I say, especially in Brazil, this worried, at least on the other government, of course, because when we gathered the data, it was still 2002 and 2022. And so we didn't see this worry about policies, because Brazil was known for its strength on vaccination campaigns and dissemination of vaccination in all around the country. And we have high rates. We never had these anti-vax movements. It was quite new. So in this sense, I think something we should address is more policies on combating misinformation. And also there is the part from the digital platforms. What we're going to do with this, with governance of digital platforms, with, in some cases, deplatformization. So I think it's a mixture that we have to do with this kind of policies.
A responsibility that should be shared between politicians and the platforms for controlling the misinformation. What do you think, Adriana, after what you told us, what do you think researchers should look at now? So what's the future research, comparing new geographies or new groups, other platforms? So what should we look at now?
I think all of these things, because when we started this research, we didn't see any comparative. We found lots of things on anti-vax movements, more in the US, more in the global north. And so we saw that there was this lack in the field. And also I have been thinking about video and TikTok, because there's been lots of conspiracy theories that have been around on TikTok and Instagram, and all the digital platforms. They are kind of, with video, they are more difficult to research because the API is closed, and there is this problem with the digital platforms for researchers, that now Twitter is closing. We don't know what it's going to do with Elon Musk. And all these things impact. So things that are from a political side and from marketing side and from how these platforms are ruling. I think it's a challenge. It's challenging to be researching this kind of things now. And maybe other movements, because some people have been researching before, like people who believes in the flat earth and this kind of things, but we were thinking more on the conspiracy theories, they were more like an anecdote.
Mm-hmm.
So now we saw the impacts that were very worried about these impacts. And I've been to Fiocruz last year. That is one of the places in Brazil where they research and they did the vaccine here. And they were saying to me, the people from there, that it has impact in other vaccines, not only in COVID.
Wow.
But for children. And this, one last thing that I forgot. The last thing is that they are using this, the people from the right, the extreme right, they are far right, they are using it. You're using vaccines for the children and it's not safe. Let's protect children, creating a moral panic for this. And this impact is awful, and it's getting in all social classes. It doesn't have to be a person who has not studied, so people from university everywhere. So it's kind of crazy.
Of course, a spillover effect to other fields and other vaccines and other groups, of course, other than adults. Do you have any materials that you'd like to share with who's listening to us, some additional materials for people to further explore the topic?
Well, I think there's a material that we have produced that is more visual, and I can leave it to you to distribute because it's on a PDF that we shared with the journalists. And we also are thinking about the way people who communicate science has to treat this, because it's another thing that we have to consider.
Of course. And for our listeners, this material that Adriana recommended will be available if you are watching us on the Let's Talk About Media and Communication website. Below the video, there will be this recommended material that Adriana just mentioned. Adriana, let's close this episode with a punchline. So if you could wrap this conversation in 1 or 2 sentences, what would it be? Although hard, what would it be?
Hard. I think that we have to be very careful with the information, especially information on health and vaccination, that we should consider to take into our lives and to do the decisions of our health, our community, because it's a collective sense that we are missing. That's the importance of the social cohesion. So, and these digital platforms, they are not caring about that. I think that is the punchline.
Perfect. Adriana, it was a pleasure. Thank you very much.
Okay, thank you.
This podcast is powered by Cogitatio Press. You can listen to this episode on the Let's Talk About Media and Communication website, on Cogitatio Press YouTube channel, and whatever you get your podcast.